Hi, Dr. Joe here, again to quote from an august medical journal, one of the best journals around for learning all that's important today. And here it is, the Wall Street Journal, talking about your risk of heart disease, how to turn back the clock when your blood vessels grow old before you do. And this, for about 5 pages, talks about all the things that happen inappropriately as your arteries age before your time, basically. This is from June 1st, 2010 in the Wall Street Journal. It's about 4 pages long, and it quotes initially, "A man is only as old as his arteries." It's women too. But this guy, Thomas Sydenham, an English physician from 1624 to 1689, very revered. He described what a murmur was and all the rest, so that cardiology got its real start with this guy. But what they talk about mainly is what we're talking about here. And you can see how the arteries can change within the framework of aging. Down the bottom you see 60 plus. When you're over 60, you see on the left side of the inside of your artery, the left side is full of plaque. That's cholesterol and a big buildup. You see in your 50s it goes down. But you don't see it very well, but in the middle of the 50, there's a little tiny place where actually the cholesterol ruptured, giving a stroke or a heart attack, whichever you don't wish to get. But that's the mechanism by which they have. They swell up so much with all that stuff in there that you really have to let it go sometimes. Well, you don't have to, but unfortunately that happens. So you get down in your 40s, it's there as well, and you get in your 30s, as you can see, it has its own little place that does a lot of things you'd rather not have. The 20s look pretty much like you get down in the bottom of this, so that you really don't have anything but little streaks. That's hopefully all everyone ever gets. We are in a situation now with all the things that we use, the new blood pressure medications, the new way we've got arginine, whole situations where the product is doing multiple things to make your arteries go back to normal. And that's how you do it. This is the most striking thing in 2 decades as far as I'm concerned. And that's what we've done by cutting down heart attacks to the point where we were sending 900 people a year off to have cardiac bypass surgery. And then we didn't have it anymore. And this made quite a difference in the way we treat people. We can see how everything can become something, and we can follow it every step of the way. The B-Pro, for example, gives you these ages of your arteries, gives you the idea that you know exactly where you're going. Inflammatory markers that are talked about in this as well are very important, and we follow them closely. And if you can get away with getting your plaque 2 down below 199, you don't have a chance of getting a heart attack or stroke in the next 4 years. We've seen it come to pass that that's true. We're very pleased. We have something to watch closely. We can watch a lot of other things. And if you don't get to where you should, we have new things that we do that actually are really exciting because they were put together when we had other Nobel laureates talking about this. Linus Pauling had other things that we can get to 0.5% of people. It has something to do we don't know yet about, but it does do something to protect you in a lot of ways. It really is your time if you don't want to get into any vascular situations.